In a month, I was not called one time.
Healthcare workers who applied to return to the field during the COVID-19 pandemic say they have yet to be placed by the Quebec government.
I haven't heard of more than one or two colleagues who sent their CVs to Je Contribue who actually have had a placement. A lot of people have been called and called. It's the same thing that happened to me at the beginning. I think 3 or 4 different people called me just to tell me that somebody else was going to call me to tell me where to go. And so that happened a few times. And at one point I was like, okay, is this ever going to happen, you know?
Premier François Legault asked healthcare workers who were no longer practicing to help, and tens of thousands applied through the Je Contribue site the Quebec government set up. Natalie is one of them. She applied over a month ago and has still not been placed. She is working now as a nurse in a long-term care facility because she applied there directly after her pregnant friend was called to possibly work.
I was so mad, so I just started calling. I'm like, I need to call. If I can work instead of somebody who's pregnant or who's sick that they're forcing to come back because of the decree, please let me work.
Marie-Sophie is in the same position. She's a former nurse who also applied over a month ago and hasn't yet been placed. She is working now because her father reached out to her directly to help at his clinic.
We are in an emergency state right now, and we really, really, really need this help, and we need to smoothen the rules a little bit, just a little bit, not necessarily on the qualifications, but on the processes to be able, in order to help, because there are some people that need to be fed and some people that need to be changed.
Shortages are particularly painful in long-term care facilities, with patients and staff contracting COVID-19 at an alarming rate. In the daily press briefings, the Premier has said the situation is dire, calling on doctor specialists and Ottawa to provide help.
We are rushing to physicians to help us, but we already have resources that are waiting to be used.
You can't ask a neurologist to safely move a frail patient from the bed to the chair.
The FIC Nurses Union and the Quebec Association of Physiotherapy have said numerous members have applied and not gotten placed.
It's so frustrating to see all these people who want to work. A lot of them, I have a friend who's a nurse, but she's willing to work for free on weekends as a orderly. And, you know, all the centers that she's called have told her, no, we don't take volunteers anymore.
On Thursday, Quebec's health minister was asked what was taking so long to place healthcare workers.
We did contact everybody we could, and there are a few probably that we missed, but we want them.
In Montreal, Tenneriello, City News.